At the Rangiora Vet Centre today, we meet Asher the Burmese cat who's suffering from conjunctivitis.
Hi Penny.
Hi, how are things today?
Oh, not that good.
Oh dear, how's Asher going?
No, her eyes are not good.
Where are you going today? Oh, she's a bit stuck in that box, isn't she? Hey, Poppet. Let's have a look. Hey. Cool, so her eyes haven't got any better?
No, they haven't. No.
One of the most common causes is viral. Oh. The most common viral cause is feline herpes virus.
Oh, unless she had it and I didn't know.
Yeah, and they can, like, as young kittens, you can get those kittens that are just sort of look a bit snotty and sneezy.
Yeah, yeah.
So what can happen is if she had, for some reason, contracted herpes virus as a kitten, 80% of cats that get herpes virus become carriers. Another really common cause of chronic conjunctivitis in cats is chlamydia. And it's not the chlamydia that we get, they're species specific. See her conjunctiva today are really red. Her right eye is worse than her left eye. Okay, and you say that she has blocked tear ducts?
Yeah.
Okay, so what we're going to do is put a little bit of dye in each eye and see, this is quite a crude test, but to see if her tear ducts flush. So we'll just put a little bit in the eye. Good girl, sweetheart. And a little bit in the eye. It's about uncomfy, isn't it, Poppet? And while we're waiting for that, I'll just check your eyes for ulcers. So this is a UV light. So I'm just looking for ulcers or erosions on her cornea, which is the surface of her eye. Oh, there's a couple of wee flecks maybe coming through there. So that gland there that I'm pulling out now, just for interest's sake, is their third eyelid. If she's got something infectious going on by taking some cells off that area, hopefully we can see them under the microscope. It's our microscope, and we just place the slide underneath. Yeah. We just need to get onto quite a high magnification so we can see the cells that we need in enough detail. This cat does have a secondary bacterial infection. So this slide's got lots of bacteria as well, so this cat's needing some more aggressive antibiotic treatment than the eye drops it's currently been on. Hi, we got some really good cells.
Right.
So what's going on in there? She's got active inflammation. She has quite a high bacterial load in her eye.
Yeah.
So that can be secondary. I don't think that's the primary reason. She's always, because she's had this since she was a kitten, hasn't she?
Yes.
Well, young cat.
Yes.
She's got a lot of white blood cells that are associated with an allergic form of conjunctivitis.
Right.
So with chlamydia, sometimes within the white blood cells there can be an inclusion, and that can be associated with chlamydia. Now, I didn't see any. It doesn't mean that it's not chlamydia. What I think we should do is put her onto an oral antibiotic. It's in a paste form called doxycycline, and that will cover the chlamydia component if there is one, but it will also help treat the bacterial infection systemically. I'll do the seedlings now. So the first ones, you don't have to do anything. I always sort of find it easier to sort of grip their little jawbones gently. If you sort of tilt them up a little bit, it's easy just to pop it on her tongue. She'll just eat it up. And the first volume in the tube's always the largest.
Right.
Well done, sweetheart, I know.
Join us next week when Clyde the dog has surgery for an orthopaedic injury.